Hey everyone, welcome back to our channel, the go-to place for information and strategies on learning disabilities, especially ADHD. In this video series, we're going to share some of the potential treatments specialists can recommend for your child's ADHD. That way you know what to expect and how to go about treating ADHD. Specifically, we're going to cover exactly how official and authoritative resources that have actually proven their legitimacy, like the Mayo Clinic, the National Institute of Mental Health or NIMH, the Child Mind Institute, Children and Adults with Attention Deficit Hyperactivity Disorder or CHAD, WebMD, and the American Psychiatric Association recommend ADHD treatments for children and adults. These are the exact same resources Dan Kramarsky, a school administrator for over 30 years and the lead instructor for our upcoming course on how to help parents handle the transition to middle school for their kids with ADHD, has used to treat his own ADHD and that of his daughter, who is now a successful university student. We know most parents would be happy knowing their kids will make it through high school safely, so take Dan as an example case study and listen closely. This series will cover 4 standard treatments for ADHD in children, including medications like stimulants, other medications, and how to give medications safely, behavior therapy like social skills training and parent skills training, counseling like psychotherapy, family therapy, and lifestyle/home remedies, and education services like school programs, individualized education programs, IEPs, and 504 plans. You and your provider should jointly develop a treatment plan that prioritizes and addresses each problem area for your child. These areas can include school challenges, self-esteem, anger management issues, co-occurring disorders such as depression or anxiety, any learning concerns, and peer and family relationships. Now, a more comprehensive treatment plan that really covers all your bases would include all or some of the following based on the unique needs of your child. Learning more about ADHD as a disorder and its causes. Learning more about diagnosing ADHD and the potential options for treatment. Hopefully we've got you covered there. Setting up behavioral therapy for your child to help manage his or her behaviors and also to acquire new skills for handling them autonomously. Understanding the differences between ADHD medications and prescriptions and how to set up regular monitoring after trying a new medication. Getting mental health counseling for you, your child, or the whole family to address things like relationships, self-esteem, discipline, and other parenting concerns. Setting up educational program modifications and supports, including 504 plans, tutoring, and special education programs. And finally, whether you should consider taking parent training classes or programs from an ADHD coach to address your child's behavior both at school and at home. An ADHD coach can also potentially help with marriage counseling, since we know that statistically, parents of kids with ADHD are twice as likely to get divorced than other parents of neurotypical kids. If you would want to set up a comprehensive plan like that, sign up for our upcoming course taught by Dan and other ADHD experts like psychiatrists, school psychologists, occupational therapists, physical therapists, and ADHD coaches. It'll help you set up and execute your child's personalized treatment plan, better your relationships both at school and at home, and handle the entire process of transitioning to middle school. Check out the link to the course in the description below. So, treating ADHD often requires medical, educational, behavioral, and psychological intervention. This comprehensive approach to treatment is sometimes called multimodal because it incorporates so many different modes of treatment. However, although these treatments can relieve many of the symptoms of ADHD and even improve physical coordination, they do not cure it. While there is no cure for ADHD currently available, treatments can help reduce symptoms and improve functioning. Know that it may take some time to determine what works best for your child. Also, as both a medical and health disclaimer, I am not a doctor, and this video does not provide medical or health advice. It is intended for informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Never ignore professional medical advice in seeking treatment because of something you have heard on this YouTube channel or from SmartCourse as a whole. If you think you may have a medical emergency, immediately call your doctor or dial 911. ADHD patients' symptoms vary significantly, so it is extremely important to speak with your physician or medical professional in order to come up with a tailored approach that works specifically for you and your child. That being said, and all things being clear, let's go over some of the best information out there. First, you're probably watching this video because you're wondering, what is the most effective ADHD treatment? Well, based on both the Child Mind Institute and the American Psychiatric Association, research shows that a combined approach of medication and behavioral therapy is the most effective treatment. For moderate to severe cases of ADHD, the first line of treatment is usually medication, more specifically ADHD medications called psychostimulants, which increase the amount of certain chemicals in the brain, help children focus, and curb impulsivity and hyperactivity. Behavioral therapies, on the other hand, help kids rein in impulsive behavior and be better organized. In general, more than one intervention is needed. By working closely with your healthcare providers and school personnel, you will be able to find the treatment options that are most suited to the unique needs of your child and family. Close cooperation among therapists, doctors, teachers, and parents is therefore very important. Now in today's video, we're just going to cover medications, specifically stimulant medications. I know what you're thinking. Isn't it unusual to treat ADHD, the hyperactive disorder, with a medication that is considered a stimulant? Aren't people with ADHD stimulated enough? Well, not really. Stimulants work because they appear to boost and balance levels of neurotransmitters, which are basically brain chemicals. Mainly dopamine, which you've probably heard of as the craving neurochemical, that stimulates the pleasure and reward center in our brains. It's the same brain chemical tech companies try to stimulate when sending you a red push notification. The other is norepinephrine, which, very simply explained, makes our body work as efficiently as possible. To remember, you can think of norepinephrine as the chemical released in your brain during a fight or flight response, because it causes several changes in our body function, including an increase in the amount of oxygen going to our brains, which helps us think clearer and faster, something very useful for people with ADHD. Both neurotransmitters play essential roles in thinking and attention. Now, currently, stimulant drugs, or psychostimulants, are the most commonly prescribed medications for ADHD. These medications help improve the signs and symptoms of inattention and hyperactivity, sometimes effectively in a short period of time. According to the Child Mind Institute, studies show there's an over 80% chance that a child with ADHD will respond to stimulant medication with a significant reduction in symptoms. Now, there are two main classes of stimulant medications. Both are very hard to pronounce. The first is methylphenidate-based medications, a mouthful, I know. Those include Ritalin, Methylin, Concerta, Metadate, Focalin, and the Daytrana patch, which is a long-acting patch that can be worn on the hip. The other group is dextroamphetamine-based medications, like Adderall, Vyvanse, Dexedrine, and Mydayis. Now, of the children who respond to stimulants, half will respond equally well to both groups of medications, and the other half will respond better to one or the other. So it may make sense to try one medication from each group. Also, stimulant drugs are available in both short-acting and long-acting forms. There are many different release formulas for stimulant medications, which make them effective for different periods of time. Immediate release formulas, or short-acting stimulant drugs, are effective for about 4 hours. Extended release formulas, or long-acting stimulant drugs, last as long as 14 hours. Now, within the extended release group, medications vary in the doses they deliver morning and afternoon. Some deliver 50% in the first half of the day and 50% in the second. Others deliver just 30% in the first half and 70% in the second. Let's talk about finding the right dose. Since different children metabolize medication in different ways, the goal is to find the formula that delivers an effective dose over a desirable period of time for your child. Getting the right dosage for a particular child takes several weeks of trial. The clinician normally increases the dosage gradually until it becomes effective. If your child experiences undesirable side effects, it may mean that the dosage is too high or the medication isn't right for her. Now, it's important to note that some children respond differently to the two different stimulants used in these medications, methylphenidate and dextroamphetamine. Changing from one to the other, or even to a different release formula of the same basic medicine, can help reduce or eliminate side effects. Once an effective dosage is established, your child should be monitored periodically to make sure it's still meeting her needs as she grows. Let's talk about stimulant medications and certain health risks. You should always ask your doctor about possible side effects of stimulants. Some research indicates that using ADHD stimulant medications with certain heart problems may be a concern, and the risk of certain psychiatric symptoms may be increased when using stimulant medications. First, let's talk about heart problems. Stimulant medication may cause an increased blood pressure or heart rate, but the increased risk of serious adverse effects or sudden death is still unproved. However, the doctor should evaluate your child for any heart condition or family history of heart disease before prescribing a stimulant medication and monitor your child during stimulant use. For psychiatric problems, stimulant medications may rarely increase the risk for agitation, psychotic, or manic symptoms. If your child has sudden new or worsening behavior or sees or hears things that aren't real while taking stimulant medication, contact the doctor immediately. Now, that said, some kids experience other adverse but less severe side effects, like sleep issues. If medication is interfering with a child's sleep, it's because the medication is still active at bedtime. If he's taking a short-acting formula, it may mean that he is taking a second or third dose too late in the day. If he's taking medication that lasts 12 or 14 hours, it may help to try one that's not quite as long-acting. Sleep issues caused by the medication tend to get better over time, so it's worth giving kids 4 to 6 weeks to see if they adjust. Trouble going to sleep may also be caused by kids being too stimulated at bedtime. Another is eating issues. Extended release medicines, which peak about 4 hours after they're taken, cause some children to lose appetite at lunchtime. Some kids can compensate for this by eating a good breakfast before the medication kicks in and eating well at the end of the day when the medicine is wearing off, at dinner and again before bedtime. Another option is to switch to the immediate release tablets, which will wear off by lunch. Another potential side effect are growth issues. Some kids, particularly boys, grow more slowly when they're taking stimulant medication, especially in the first year. But studies show that by the second and third year they catch up. Also, kids who take weekend breaks or summer vacations from the medication don't show the slowdown in growth. Another one is nausea and headaches. These problems tend to dissipate within a few weeks of beginning medication and can be minimized by taking the medication with food and in some cases by changing the dosage or schedule. Another one is rebound. In some cases, after the medication wears off, a child becomes irritable and aggressive. The Child Mind Institute calls this rebound, and it means that the medication is leaving the body too quickly. One way to avoid rebound, if it's a problem, is by adding a smaller dose a half hour before it usually happens to ease off the medication more gradually. Sometimes rebound can be a sign that the clinician hasn't got the right dose yet or that a different medicine should be tried. Lastly, when a child rebounds, it's important to consider whether there might be something else going on, like an underlying anxiety or mood issue that comes into play when she comes off her ADHD medicine. Another one is tics. Some children who take stimulant medication develop tics. When that happens, the first thing your doctor might want to do is try a different stimulant to see if another medication will work without the tics. If that doesn't work, the doctor may try a non-stimulant medication, which affects the brain in a different way. We'll cover those later in this video. Now, another popular side effect are mood changes. When a stimulant dose is too high for a child, he may begin to look sedated or zombie-like, or tearful and irritable. If this happens, the dose needs to be reduced. But there is also a small subset of kids with ADHD who seem to get moody and sad or irritable when they take stimulant medications, even at the best possible dose. It usually happens right away as soon as they start taking the medication and goes away immediately when they stop taking it. If this happens, your doctor can try switching to a different stimulant or non-stimulant medication. All right, let's talk about other non-stimulant medications. After hearing about all those side effects, you're probably wondering, are there non-stimulant medications for ADHD? And the answer is yes. Non-stimulant medications are useful for kids who don't respond to stimulant medications, can't take stimulant medications because of health problems, experience adverse side effects from them, or sometimes they're taken in combination with a stimulant medication to increase effectiveness. There are 3 types of medications that aren't stimulants that can help alleviate symptoms of ADHD. The first is called atomoxetine, which is sold as Strattera. It's in a class of drugs called norepinephrine reuptake inhibitors. Like we talked about earlier, norepinephrine is a natural substance in the brain that is needed to control behavior. The second is antidepressants, such as bupropion, which is sold as Wellbutrin SR, Wellbutrin XL, and others. Although not approved by the US Food and Drug Administration, or FDA, specifically for the treatment of ADHD, some antidepressants are sometimes used alone or in combination with a stimulant to treat ADHD. Antidepressants may help all of the symptoms of ADHD and can be prescribed if a patient has bothersome side effects from stimulants. Antidepressants can also be helpful in combination with stimulants if a patient also has another condition, such as an anxiety disorder, depression, or another mood disorder. Although you should know that both atomoxetine and antidepressants work slower than stimulants do and may take several weeks before they take full effect. Now, the third type of non-stimulant medication are called clonidine, such as Ketopress or Nexicon, and guanfacine, sold as Tenex. Those are called alpha-adrenergic agonists. I'm sure at this point you've realized these names are going to be hard to pronounce and remember. Now, clonidine and guanfacine were developed to lower high blood pressure but at the doses given to kids for ADHD, they rarely affect blood pressure. Both clonidine and guanfacine come in a 24-hour release version sold as Capve or Intuniv, and they are sometimes used to treat tics. Finally, as a potential supplement or diet change, omega fatty acids can also be helpful for ADHD, though not as helpful as stimulants or these other medications. I've linked to a WebMD article in the description below that explains the benefits and dangers of omega fatty acids. Now let's talk about suicidal risk. Although it remains unproved, concerns have been raised that there may be a slightly increased risk of suicidal thinking in children and teenagers taking non-stimulant ADHD medication or antidepressants. Contact your child's doctor if you notice any signs of suicidal thinking or other signs of depression. Let's go over giving medications safely. It's very important to make sure your child takes the right amount of prescribed medication. Parents may be concerned about stimulants and the risk of abuse and addiction. Stimulant medications are considered safe when your child takes the medication as prescribed by the doctor. Your child should see the doctor regularly to determine if the medication needs to be adjusted. The doctor needs to monitor the dosage of the stimulant medication closely, both to determine the most effective level of drug and to watch for any side effects. On the other hand, there's concern that other people might misuse or abuse stimulant medication prescribed for children and teenagers with ADHD. To keep your child's medication safe and to make sure your child is getting the right dose at the right time, give medications carefully. Children and teens shouldn't be in charge of their own ADHD medication without proper supervision. At home, keep medication locked in a child-proof container and store medication away from the reach of children. An overdose of stimulant drugs is serious and potentially fatal. Don't send supplies of medication to school with your child. Deliver any medication yourself to the school nurse or health office. Now, some people wonder, should children stop taking ADHD medication during holidays and the summer? Since children with ADHD don't need to perform academically during summer or on extended holidays, parents sometimes seize the opportunity to take their kids off their regular medication regimen, especially if they are experiencing side effects. Other parents avoid an interruption, fearing that their children's behavior problems will rebound. Now, one reason to stay with treatment year-round is that ADHD doesn't only affect a child's performance in school. During the summer, children still have to get along with family and friends and function effectively in group activities like sports and camp. However, if you are concerned that taking a stimulant medication may be slowing your child's growth, a summer break can allow him to catch up. And if you are concerned that he is underweight due to suppressed appetite, a summer without medication can help him put on some pounds. I've linked to another article in the description below by the Child Mind Institute that covers more of the pros and cons of stopping medication during holidays and over the summer, otherwise known as a drug holiday. Now you know what to expect from specialists in regards to ADHD treatment with ADHD medications. But remember that there are many other ways of treating ADHD. To make sure you're as prepared as you can be, I want you to hit the notification bell below, because in the next video we'll cover different behavioral therapies suggested by the Mayo Clinic, the National Institute of Mental Health, or NIMH, the Child Mind Institute, children and adults with attention deficit hyperactivity disorder, or CHAD, WebMD, and the American Psychiatric Association. Again, I am not a doctor, so I will not give you any medical advice, but still, it helps to hear what the experts suggest. So again, hit the notification bell and the subscribe button under this video if you want to be notified when we publish that video. In the meantime, while you wait for that video, I've got some special offers for you. But first, if you like this video, please don't forget to like it and let us know what you liked or what you'd like to see more of in the comments below. The more people like, subscribe, click the notification bell, and comment, the more people will see this kind of content on YouTube. And we know some people could really use the help. Now, if you're looking for extra help, I'd also really recommend joining our expert-vetted newsletter. It'll be free until October 3rd, 2019, so don't wait up. Our resources will help you find answers to your basic questions about ADHD, understand why middle school is so challenging for students with ADHD, and introduce you to ADHD support groups and other sites to help you meet your child's needs at school and at home. Visit the links in the description and on your screen. You can also join our expert-moderated ADHD education and support group for parents, where you can get direct help from experts and other parents with shared experiences. Now, while you're waiting for our next video, make sure to check out these two videos right here. We share tons of expert-vetted resources on parenting and education for differently abled kids, just like kids with ADHD, so make sure to check out these two videos as well. As always, I appreciate you taking the time. Thank you for watching, and see you next week.